Okay, let's talk about something that's brewing in Indian healthcare. We've got two really crucial pillars of rehabilitation: physiotherapists and occupational therapists. And right now, they're caught in a quiet but pretty intense professional conflict. We're going to dig into a really sensitive question today. Is one profession actually taking over the other's job? Let's get right into it.
You see this? This kind of sentiment is bubbling just under the surface in clinics and hospitals all over the country. It points to a turf war that a lot of people feel is chipping away at their professional identity, their respect, and the trust between colleagues who really should be allies. So, what's the deal here? Is this just a simple misunderstanding, or is there a genuine scope drift happening where one profession is stepping on the other's toes? This isn't just about professional pride. This is a conflict that has real-world consequences for careers, for salaries, and most importantly, for patient care. And look, this tension didn't just appear out of nowhere. It's being fueled by some very specific things. You've got blurred clinical boundaries, you've got some big differences in pay, and a regulatory landscape that's shifting under the new National Commission for Allied and Healthcare Professions, the NCAHP. Before we dive into all the grievances and the drama, we've got to get back to basics. What are these professions actually supposed to do? Because at their core, physiotherapy and occupational therapy are two very distinct fields. And to get what the conflict is about, we first have to be crystal clear on what each one does. Let's start with physiotherapy, or PT. You really have to think of PTs as the undisputed experts in movement. Their entire education is built on anatomy, biomechanics, and exercise science. Their whole job is to restore strength, mobility, and physical function. And they use tools like therapeutic exercise, hands-on manual therapy, and different pain management techniques to get it done. Now, let's look at occupational therapy, or OT. OTs are the experts in function. See, their goal isn't just about making a patient stronger. It's about helping them get back to doing the meaningful things in their daily life, their occupations. And that can be anything from self-care to work to hobbies. They focus on fine motor skills, cognitive training, and even adapting a person's environment to help them get their independence back. So here's probably the simplest way to think about it. Physiotherapy restores movement using exercise. Occupational therapy restores function using daily tasks. One is all about the big movements, the gross motor skills. The other is about the delicate, detailed stuff, the fine motor skills. When they're working the way they're supposed to, they are the perfect team for a patient's recovery. But that ideal partnership, well, it seems to be breaking down. From the physiotherapist's point of view, their entire profession is being systematically undermined. So let's explore exactly why they feel things have gotten so unfair. And really, the frustration boils down to three main areas: a drift in the scope of practice, a battle over professional titles, and a very, very real difference in salaries. Let's unpack each one of these. Okay, the first and biggest issue is what PTs call scope drift. They're seeing OTs doing tasks that have, for a very long time, been the bread and butter of physiotherapy, things like prescribing strengthening exercises or using classic PT equipment. And the key point here isn't just about competition. PTs argue that this blurs the professional lines and could actually hurt the quality of care because OTs just don't have the same deep, specialized training in exercise science. Then there's this whole battle for respect, and it's all symbolized by that doctor prefix. Physiotherapists fought for decades. I mean, they climbed a really steep mountain against tons of opposition to earn that title. And now they feel that under the new NCAHP rules, OTs were just handed that same recognition on an escalator. And finally, it comes down to money. There's a pretty noticeable gap in entry-level pay. An OT graduate might start out making 25,000 to over 40,000 rupees a month. Meanwhile, a PT graduate often starts somewhere between 15 and 25,000, and they often have a much more physically demanding job. This financial gap is a constant source of frustration, and it really fuels a deep sense of injustice. But is it really that simple? Is this really a case of one profession intentionally trying to undermine another one? To get the full picture, we have to look past the individual blame game and start examining the system itself. Because here's the thing, and this is so important to understand. Occupational therapists are not the enemy here. They are highly skilled, absolutely vital professionals. The problem is just way more complex than that. In fact, OTs are indispensable. Their expertise in fine motor control, cognitive rehab, designing adaptive equipment, they fill these critical gaps that physiotherapy simply doesn't address. When OTs are focused on their core mission, restoring function for daily life, they are powerful allies, not competitors.
So what's really driving this overlap then? Well, it's often systemic, not personal. You've got hospitals merging departments just for convenience. You've got regulatory bodies that fail to draw and enforce clear boundaries. And frankly, you have a public that often just doesn't get the difference. They think, don't they both just give exercises? In an environment that confusing, an OT might feel pressured to start using exercises just to stay relevant, not because they're trying to steal anyone's job.
So if the problem is basically baked into the system, then the solution has to be systemic too. How can these two essential professions get from this place of conflict to a place of real collaboration?
Well, the first step, as this quote really powerfully suggests, is excellence. The best path forward for physiotherapists isn't through protests or arguments, but through getting undeniable results with their patients. When you are the absolute best at movement science and you consistently deliver superior outcomes, your value becomes impossible to ignore or replace.
This is the ideal future. A collaborative model where each profession operates with confidence inside its own clear boundaries. PT restores movement, OT restores function. PT handles the big physical challenges, OT handles the intricate skills of daily living. And you know the ultimate winner is in that scenario? It's not a profession. It's the patient who gets truly holistic, comprehensive, and effective care.
So, what's our final verdict? Well, let's be clear. The scope drift that physiotherapists are worried about, yes, it's a real issue. But the fault lies less with individual therapists and more with a flawed system. This conflict is actually an opportunity. It's a chance for both of these incredible professions to reassert their unique expertise and build a stronger, more collaborative future together. And maybe this is the most important thing to take away from all of this. The future of rehabilitation in India really depends on professionals who can celebrate the skills of their colleagues, while at the same time, fiercely protecting the integrity and identity of their own field. It's not about winning a turf war. It's about earning respect through excellence, through ethics, and through a shared commitment to the one person who matters most, the patient.